So thanks, everybody. Today I'm going to talk about some helpful tools for data collection and analysis in gender-based violence projects. And what I'll do in this session is talk about criteria for the selection of sound indicators, sources where you can find standardized indicators for GBV programs. These are indicators that have been pre-tested. A lot of donors have, organizations have agreed on how these indicators should be measured. And you do find this compendium of indicators that tell you a lot about those. So it's not like reinventing the wheel. You can always go to a compendium and see if there's something that you can adapt from it. We'll identify the purpose, strengths, and limitations of different evaluation designs. Distinguish between those that enable a program to causally link its activities to observe changes and designs that do not, and then link evaluation designs to the type of questions that programs need to answer. So we can use both qualitative and quantitative data, and both have value, and there is no one right approach. Most evaluations these days are using mixed methods approaches. So they're using both quantitative and qualitative. And one of the things one needs to do is consider what one needs to know and what questions we need answered. So like qualitative can tell you a lot about why certain things occurred or did not occur, constraints and facilitators, whereas quantitative data can easily give you measures, quantitative measures that can be used to objectively assess whether a certain change has occurred. And the different questions require different approaches, and participatory methods are often employed. I work a lot in Africa, so participatory methods are very important there. So I'll talk now about the program life cycle. Of course, monitoring and evaluation occurs right through the program life cycle. You have phase one, the assessment stage, when you're trying to find out what's the nature of the problem. And then you go to strategic planning, where you're trying to find out what primary objectives should the program pursue to address the problem. And here is where you're deciding on your SMART objectives, your goals. You're doing your human-centered design to kind of figure out how users are, what users' experiences are, and what users' perceptions are regarding how a particular problem can be addressed. Then you get to the design stage. What strategy, interventions, and approaches should the program use to achieve these priorities? When we come to the implementation stage, which is stage 4, where we're doing monitoring, the key question is, how do I know the activities are being implemented as designed? How much does implementation vary from site to site? And how can the program become more effective or efficient? The question about program fidelity is very important for large programs that are implemented in multiple sites by different actors, because sometimes you find little modifications here and there. So this is something that should be documented along as the program goes along, so that in the final analysis, one can have a sense of how the program activities were actually implemented. Evaluation stage, which is where a lot of people have a lot of interest. How do you know the strategy is working? And how do you judge if the intervention is making a difference? And sometimes, you know, like in my current project, it's among whom, among which group is the intervention making a difference? Because what we're seeing in my evaluation, which is an aside thing, is that not all groups, there are some subgroups of the population that were kind of unaffected by the intervention. So that is something you want to find out as well from an evaluation. So we have different types of indicators. And the indicator is something that's specific it's observable, it's measurable. And you can use that to show change or progress a program is making towards achieving a specific outcome, whether that outcome is knowledge, attitudes, or behavior. So quantitative indicators can have different metrics. That means the precise way in which they are measured and the data that goes into the measurement. They can be counted, they're directly counted. They can be expressed as percentages, as number of, as frequency, as ratio, as amount of, or timeliness of. And you can have qualitative indicators. They're qualitative because they involve perception, but they can be analyzed quantitatively. So like a level of support, for example, congruence with, level of satisfaction with something, knowledge of, ability to do something, the appropriateness of something, or the importance of something. These are people's perceptions about particular aspects or outcomes that a project might be interested in. I have not talked about composite indicators here because usually these, I've tried to put into this presentation stuff that we usually teach over 2 4-hour sessions with group projects and activities, small group activities. So there are some things that I may not cover, but please use the chat if you have any questions. So these are characteristics of good indicators. A good indicator is a valid or accurate measure of a behavior, practice, or task. So what do we mean by valid indicators? For example, one that is used in HIV is that somebody's willingness to buy vegetables from a person who is HIV positive. Is that level of willingness an actual measure of stigma? So it's about, are we actually measuring what we want to measure? Is the indicator reliable? Can it be consistently measured in the same way by different people? Is it precise? Is it operationally defined in clear terms? When we talk about precise, I'll give you an example. So in a lot of urban centers in Africa, there are people who sometimes walk around from house to house and they have a tray and they have piles of pills on it. And they tell you, this one is Tylenol for headache, this is Panadol, this is this, and this is that. So if you want to know the number of providers that are doing something, do you want to consider them a provider? So do you want to consider your juju man, who is like an obeah man, as a provider? Is that a provider? And your traditional birth attendants, do you want to consider them as providers, regardless of whether they have scientific training? So you have to define what's a provider. And then in terms of training, what does training mean? So sometimes we have students, and you didn't hear this from me, they'll come to class like 1 week and then you don't see them until the end of the semester, especially if you have a large class. So would you say that person has been trained if they attended like 1 week of an 8-week session? So that's what we mean by precise. So for all these definitions in your indicator, all these terms, it's important to provide a clear definition. Otherwise, the indicator will be measured in different ways by different people. You want your indicator to be measurable, quantifiable using available tools and methods, to be timely, to be measured at a time or at intervals that are relevant and appropriate in terms of program goals and activities, and they're programmatically important. They should be linked to the program or to achieving the program objectives that are needed for public health impact. And one useful thing to do is that if a project has like a logic model, then you have to say, how are your indicators linked to your logic model, to the different aspects that are mentioned in your logic model? And then this, I think it's important to emphasize that while indicators measure change, the definition should not include a direction of change. And that's because it's only when you measure the indicator at more than one point in time, more than once, that you can find out if the change is an improvement, whether the value of the indicator increased, whether it decreased, or whether it stayed the same. So it's important when specifying indicators that this level of change, a type of change, should not be part of the indicator definition. So there are some challenges in choosing indicators. And one of them is choosing an indicator that program activities cannot affect. And it's very important, I think, when we are defining indicators, that we look back at our program activities. That's where the logic model comes into play again, because one would have identified the program activities under processes and think about what exactly will this program activity achieve. So choosing an indicator that is too vague. And so we're talking about using precise words and precise terms and phrases to define indicators, choosing indicators that do not currently exist and cannot realistically be collected. Sometimes a project doesn't have enough funds or resources to measure an indicator. And so sometimes one also wants to use indicators that may be collected by another organization or through another survey to measure the indicator, kind of like as a proxy. But sometimes, even if the data source exists, some organizations might not be willing to let you have access to them, to the data. And the indicator may not have been measured the way that your program activities are formulated, and that would be useful for the measurement. So sometimes we end up selecting an indicator that does not accurately represent the desired outcome. And sometimes we have too many indicators. How many indicators are enough? We'll come to that later on. So here are some sources for getting standardized indicators. And I wanted to point out this one, which is by Sheila Bloom, Violence Against Women and Girls, a compendium of monitoring and evaluation indicators, excuse me, which is available, and it covers a whole lot of programmatic sectors like health, education, justice and security, social welfare, then humanitarian emergencies, femicide. And it also covers prevention programs in 3 areas: youth, community mobilization, and working with men and boys. So that's you know, I use that quite a bit. I kind of like it. It documents how to measure the indicator, the definition, what goes in the numerator, what goes in the denominator, and then the limitations of the indicator or shortcomings, and what exactly the indicator measures. Then for people who are working in conflict-affected settings, our HRC consortium has gender-based violence tools and manuals, and for program design, monitoring, and evaluation, those are useful as well. And there is a compendium of gender skills. This is important for composite indicators. So for example, if people are working on men's attitudes towards gender equity, this compendium has the gender equitable men's scale, GEM scale. It has a whole lot of scales, sexual relation power scale, and it talks about the questions that are used to form the scale and gives you more information about the scales. Sometimes it's hard to find the output indicators. And the Family Planning and Reproductive Health Indicators database actually has a lot of indicators, even for training, behavior change communication, that one can adapt for gender-based violence programs, even collaboration and coordination. And so you can have some sense of what indicators have been developed by others and kind of accepted throughout the family planning and reproductive health community, and then you can adapt it for your own use. So we also have the UNFP and USAID GBV monitoring and evaluation toolkits. All of these are available freely on the web. This is an indicator reference or information sheet. It usually has 4 pages, but I'm only showing one. And it's something that you can also find through an internet search. And it's was developed by USAID as a way of documenting how indicators should be measured. And it's very important because it tells you to what level of a results framework or sometimes logic model the indicator pertains. It tells you exactly how it's measured, how the data are collected to measure it. And it's one way of getting institutional memory, because once you can document this for each indicator, if you have a lot of partners that are collecting data and working on your project, then once they have these sheets, it kind of tells them how they should measure the indicator, how they should break it down into subgroups, and exactly what are the known limitations. It looks at the target, it documents things. So it's a way of getting project memory. Sorry. So I've talked about the indicator compendium, and here I've put down some illustrative indicators. So for example, for community mobilization, if you have bystander interventions, you have proportion of people who would assist a woman being beaten by her husband or partner. All of these indicators are in the Violence Against Women and Girls compendium of indicators. I'll also show illustrative indicators for social and behavior change. And if you need these slides, Melissa has them. So you can always ask her for a copy. You have, for example, for social and behavior change, a proportion of people who have been exposed to violence against women and girls prevention messages, proportion of girls who say that they would be willing to report any experience of unwanted sexual activity. And you can review the others and move on to the next slide. For service delivery, which are also found in the Violence Against Women and Girls compendium, proportion of health units that have documented and adopted a protocol for the clinical management of violence against women and girl survivors, and proportion of health units with at least one service provider trained to care for and refer violence against women and girl survivors. So it depends on what type of activity your program is undertaking. There are some people who work in law and policy, and here are illustrative indicators. Proportion of law enforcement units following a nationally established protocol for violence against women and girl complaints, and the number of law enforcement professionals trained to respond to incidents of violence against women and girls according to an established protocol. So I think this is all that I have about indicators. I want to move now to evaluation design. I understand that some partners are at the evaluation stage, so this might be a useful refresher or a useful guide for how to go about it. So one of the first questions one has to answer or ask oneself is, what do we want the evaluation to demonstrate? And here are some answers to that question. Did the desired outcome occur? Did the new procedures or interventions or inputs make a difference? And can we attribute this change, the change in the outcome or the outcome, to the program, process, or intervention? And all these questions imply a different evaluation design. One useful way of thinking about an evaluation design is to think about what question do you want to answer, what question needs to be answered. So most projects want to know, are the services available? Are they accessible? Is their quality adequate if they are working on service provision? Or for utilization, these projects might also want to know whether the services are being used. For coverage, they may want to know, is the target population being reached? And for effectiveness and impact, were there improvements in disease patterns or health-related behavior? Knowledge, attitudes, and practices sometimes are included in these outcomes. And were they due to the program? So there's some logical order to these questions, and different people tend to be interested in different things. So if you're a program manager, maybe you're looking at the first four. Some donors are very much interested in the last set of questions, whether there are improvements in health behaviors, and were they due to the program? And these questions imply different evaluation designs, and they have different cost implications as well. While you can look at provision, to some extent utilization and coverage, using routine information systems, whether that are developed by projects or health facilities or the Ministry of Health, for effectiveness and impact, you almost always need some kind of field data collection. And that has some costs associated with it. Another way is to think about the 6 fundamental questions. The first is, how do you intend to use the results? The second question, what do you want to measure? Do you want to measure provision? Do you want to measure utilization? Do you want to measure service coverage, effectiveness, or impact? The third question, which is very important, is how sure do you want to be? Sometimes it's referred to as a type of inference. And the way of thinking about it is, what's the cost of making a mistake? I call this good because we'll come to this term later on. So if you're developing a vaccine, you cannot afford to make a mistake. So the cost of making a mistake is very high. If you're thinking about what's the best way to train people, do you give them online training? Do you give them in-person training? Do you use peer leaders to train them? The cost of making a mistake is not as high as when you develop a vaccine. So if the cost is high, you need very rigorous evaluation design. When do you need the results? I'll call that fast. Sometimes we say that, and I'm sorry about the donor that's there. Donors need the information yesterday. So if it's fast, there are certain designs you cannot use because they require time in order for you to measure your outcomes properly. How much are you willing to pay? I call that cheap. It could be expensive, but I call that cheap. There are cost implications. And the other question, which is very critical, is where are you now? How much time do I have? 5 minutes? Okay, where in the program life cycle are you now? So let's go back to this. This is one design, non-experimental. Many times we see programs implement the program and then they assess the target group after the program. This is a very common design. As you can see, we have white space around here to the left. There is no baseline. So you cannot tell how much change occurred because there is no baseline. But this is good for certain things. Every evaluation design can answer a particular question. So if you wanted to know if 80% of bystanders would intervene when they see a case of intimate partner violence, and you've established that level at 80%, this design is fine to address that question. The second one, which has a baseline, pre and post, baseline and end line. So you do a survey before the program is implemented, and then you do a survey afterwards, or you collect data afterwards. Because you have a baseline here, you can assess how much change has occurred. That's very good because you can see whether there's change or there is no change, but you cannot tell whether that change is due to the program. So if you're working in a geographical area, for example, you don't know whether the other areas that did not get your program also changed, because change happens. Nowadays, we have the internet, people are listening to all sorts of things. There's so much communication going on. Change can happen even if you do nothing. So you know that here in your target group, change occurred, but you don't know whether you're responsible for it. So this is a quasi-experimental design, and it's pre and post, but it has a comparison group. But that comparison group is selected and not randomly assigned. So this is the design that I'm using in, I have a project in the DRC. So this is in the Democratic Republic of Congo. So this is the design we're using. So you do a baseline in the intervention group, have an intervention group and a comparison group. You do a baseline in the intervention group and a baseline in the comparison group. You implement the program in the intervention group. Your comparison group gets no program, or it gets an alternative program. Then you do an end line or follow-up survey in both the intervention group and the comparison group. This is costly. It's costly because you're doing like 4 surveys, one here before and after in both. So you have 2 surveys, and then you have 2 before and 2 surveys after. Then you have the experimental design, pre and post program, but you're randomizing your control, you're randomizing. So when you randomly assign people to either the intervention or the control group, you are kind of giving everybody an equal chance of belonging to either group. So you can be randomized, you get a target group, both of them are going to have a baseline survey. You're going to implement the program with target group A. The control group can get no program. It could get an alternative program, and then you assess afterwards. It's like, let's say you have a school and you decide, okay, you're going to have a curriculum on dating violence prevention. You can randomly assign students to the school, to the group A or group B, the experimental group or the control group. Sometimes it's difficult to implement, this kind of randomization because, I don't know, in Sub-Saharan Africa, it has been difficult with non-medical surveys, but sometimes you have community randomized groups. Okay, so how much confidence do you have that the program caused a change? So, low confidence. When you are asking questions such as, did the expected changes occur? Are the objectives being met? Were activities performed as planned? You may or may not require a before and after comparison. It does not require a randomized control or a non-randomized comparison group. And this is your basic non-experimental design. If it's medium, you can have medium confidence. Did the program seem to have an effect above and beyond other external influences? This requires a before and after design with comparison group and statistical controls for confounding factors. This is your quasi-experimental design. You still can say, like I found from one journal reviewer, that your program caused the change. You can only say it's plausible that the program caused the change. And if you have high confidence that the program caused the change, the question is whether the effect you see is due to the program. And you have to determine the statistical probability that the intervention caused the change that you're observing. It requires a before and after comparison with a randomized control group, and that's your experimental design. So to end this presentation, I have good, fast, cheap, pick two. You can't have all three, because if it's going to be good, you have to have a baseline and an end line. And you're going to have a comparison and control or a control group. It's not going to be cheap, and it's not going to be fast because time is involved. The other thing too is that not everybody has the statistical skills that are needed for sample size determination or sample implementation. It's always good to hire somebody to help you out. And then no evaluation design is immune to problems. Even if you follow people up, some of them sometimes drop out, you can't find them. So it's important to know what the limitations are of your design. So I'm sorry if this has been too fast. And this brings me to the end of the presentation. And if you have any questions, please put them in the chat and I'll do my best to respond to them. Thank you.
Thank you so much. We have a discussion at the end, but if anyone has any pressing questions you don't want to forget, you can either open your mic or raise your hand or write them on the chat. Is Nike Ledan, and she's a social justice defendant, committed feminist of heart that brings forward 20 years of experience, although you wouldn't tell when you see her, in human rights and environmental health justice advocacy, socioeconomic and food safety program management, and also civil society capacity building. She has built an extensive work in Canada, in West Africa, and Haiti in civil rights advocacy and social determinants of oppression. She's also a conference leader, dialogue facilitator, and known for making space for the unheard rather than speaking for. She's presently the Director of International Policy and Advocacy at HealthGap, and she will be talking about how we can use data for advocacy. Welcome, Nike. Thank you so much for being here with us today.
Hi, everyone. Thank you for having me. Very happy to be here. Please let me know if you hear me well. I have a new headphone.
Yes, we can hear you well.
Okay, perfect. So I will start. So we're thinking, I'm very happy to come right after, expert Anastasia, because we're going to talk about qualitative and quantitative a little bit, but in a context of really looking at how we how we use data for change, how we use data to empower communities and activists to professionalize their ask. Oftentimes, advocacy, not when carried without data, is questionable. It's questioned by duty bearers, by policymakers, by people in positions of power that might or might not be resistant to implementing change. And because change is constant, but change is also hard to to implement. So I'll start first by looking at quantitative, the importance of numbers, which is like really an interesting concept because like people are valid, their human existence are valid, and what the feedback that they give us on the effectiveness or lack of either programs, but also policy, also practice, also norms, right, is enough, should be enough. But what happens is whenever we get information that is not backed by statistics or numbers, we cannot talk about structural change in a way that is effective, in a way that will influence the duty bearers, because we will get the pushback that, you know, it just might be anecdotal. So this is why it's important to look at the power of numbers. So I'll check the chat at the same time. Okay, good. Just making sure that you can hear me and that I'm not getting feedback. The power of numbers is very important because then it challenges this assumption of things just being anecdotal. So this is a database that I found in assessing gender bias in judicial decision. And we're looking at like a compilation, it's a database that's looking at like, different indicators, and looking at contentious factors in mitigation, either gender stereotype, gender norms, and others. And this allows the utilization of the data, like what is the judge willing to look at as like elements to make a case or to reduce, sentences for perpetrator of violence. We also have data on like the age group of the people that are most likely to receive the violence, which are definitely young girls and adolescent girls. So it's really fundamental to when doing the advocacy, when planning like our advocacy, to use as much as possible like research data, and evaluation data. Another type of very interesting data, quantitative data that's like a bit more ongoing these days, community-led advocacy data. This is an example of a database of a community-led monitoring project in Malawi. We're looking at 3,737 interview between Q1 of 2023, which is, no, it's not, it's Q4 2022. And these are the different questions that are monitored in the different services of gender-based violence that are available at different health facilities in different districts. And this allows really to organize the advocacy ask, to organize how we go about creating a response, an advocacy response. And we will see what this can look like, an advocacy response, right? But definitely having qualitative is like what will make us, when I mean us, I mean civil society, activists, community leaders, people affected by the health outcome or the situation that needs to be changed, service users. It brings really added value to the advocacy that we're doing when it's done by and for, but that's using good data with integrity. When I mean data with integrity, is data that is like built with like the right indicators and that are that are collected with all the scientific back requirements and also the ethical requirements, right? And the other part, like that Anastasia walked us through also, is the importance of qualitative data. It's like not the necessarily percentage or how many or the number, but the what happened and how it happened, or you know, in evaluation. I'm coming more from an advocacy perspective, but in evaluation, it's more the how, right, of the question. It's really important to use the story because the story will touch. It will create an emotional response that, when back with the quantitative, with the number, is a recipe for successful response, at least for addressing the issue with impact. Art is used a lot in looking at advocacy messages. Another thing that's really been important to amplify demands is using live testimonies, actual humans talking about the oppression or the whatever it is that needs to be changed. And using diverse types of media is also very important. One thing that has been more and more relevant recently is using the voice of the people to do the advocacy and not talking for people. More and more, you know, advocacy leaders and experts are using their platforms as a bridge to bring, you know, voices and people that would not be you know, in a position to tell a story, but let them tell their own story in order to have an impactful advocacy. So I think the best approach, like, again, this is like talking about the power of stories and using advocacy. It's very fundamental, and it brings a level of like respect in the advocacy strategy. It's also deeply decolonizing because, unfortunately, colonization and you know, is everywhere, like, and also in science and in data. And more it's important to think about like ways to decolonize our framework and not talking in the name of people and not using people's data, but using our platform and the data and the allyship and the solidarity to bring the voices where and bring people as much as we can. We cannot bring 10,000 people to talk. That's why we use the numbers, but we can definitely bring forth people's stories in a way that's empowering and that's not creating some sort of like more damage. So there's like the responsibility of advocacy. Another way that's really been impactful, and Anastasia spoke about that right before me, is putting the two types of data together when creating an advocacy ask. So here we have an ask, which is to expand a certain particular project in Haiti, and here we have at the on the right side of the screen more like quantitative data that can be found to back the story of the young woman that we're looking at, this particular story, and the reason why we would need you know, new approaches and a response to violence for adolescent, a response to violence against adolescent girls and young women. So there you can like see how triangulation is powerful. You look at like the quantitative data, you have a qualitative, you have a testimony, which is a qualitative data. Then when you triangulate, then you can like project and present your advocacy ask in a way that is more impactful for the receiving end, because the advocacy oftentimes is targeted at duty bearer power holders, like the faces of the resistant force that the advocacy is targeting in order to change situation and to stop either like violence or damaging practices. So this advocacy, it's important to target the duty bearers and then look at like our audience, and it can engage at all level. It can be, at community level. It can be duty bearers at a school when we want to implement like sexual and reproductive health programs, for example, or church when we want, leaders, religious leaders to help, raise awareness on like a prevalence of COVID-19. It can also be like district, provincial, national at all level. And the advocacy objective are also plural. It can be a policy at all level. We can have a policy at the school level and also have a policy at international level, like a norms, right? Legal norms. We can have budgetary objective, programmatic objective, legal, or it can also like be practice and behavioral change, like challenging behavior, which is like a little bit more requiring like more long-term persistent advocacy action items and a longer-term advocacy strategy, and also harder to evaluate, as we saw earlier in the presentation, and all the different methods that can be used, like with either campaign and lobbying when we're looking at policy and budget, congregative when we're looking at like practice, awareness raising also. But when we're looking at like more like behavior change and legal change, we're looking at like sometimes more perceived aggressive methods such as sit-ins, walk, public denunciation, and or community accountability meetings, for example, or other types of methods. More tips for strong advocacy strategy. It's important to invest, I think. Advocacy is not free. Nothing is free. Everything has a price for sure, but like activist work is work. And it's important, the return on investment on training on data to master advocacy for grassroots leaders, grassroots activists, and grassroots service users is key. Also, it takes a lot of like communication effort and communication capacity building, although I struggle with the term capacity building. I would say more like collaboration and skill sharing, and also like the deconstruction, like I said, of the colonial framework of thinking, like knowledge sits one place and then the recipient of knowledge sits another place, creating way more exchange of knowledge, more South solidarity. And more community of practice, and centers of expertise amongst civil society leaders, and that is like part of the courageous engagement that I invite all of us to take on. So I was brief, and I hope that it's good. Thank you, everyone.
Thank you so much, Nike. Was wonderful. I couldn't agree more about knowledge carrying, and anyone has a pressing question? If not, we'll have all the discussion at the end. Some housekeeping right now. So I'm very happy to introduce Cecia Molina, who holds a bachelor's degree in administrative informatics and a specialization in data analysis and a master's degree in project management. She is an M&E expert with more than 9 years of experience in nonprofit organizations mainly in functions related to monitoring, evaluation, and learning, and more than 12 years of experience working on issues related to data collection, data management, and data analysis. She has worked on sexual health, sexual and reproductive health, reduction of HIV and other STIs, monitoring and care for people living with HIV, gender-based violence, stigma and discrimination, among other issues. And she believes that the work that NGOs do and the impact that they create in favor of those most in need, and she's satisfied that her work contributes to the construction of a more just and dignified society. So I am, as I said, extremely happy to have Cecia here. And at this point, please click on the interpretation button on your screen. Can everyone find it? I don't find it, but maybe it's because I'm the host. Melissa, is everything okay, sir?
Yes, everything is okay. At the bottom of the screen, you can see the little like world logo with the interpretation.
I don't get it, so.
So when you click on it, you will see two options, English or Spanish, and then you can click on the language that you prefer, and we have a live interpreter doing the translation.
Okay. Thank you, Melissa. And thank you, Cecia. You're welcome to start.
Hola a todos, ¿me escuchan bien?
Sí, te escuchamos bien.
Gracias, Ana, por la introducción. Bueno, estoy mejorando mi inglés, pero es muy importante para mí que me entiendan, así que gracias por la traducción. Nada, pues vamos a empezar con esto que es más que todo una introducción de lo que son los planes o el concepto en sí de mejora continua. Y vamos a...
Perdona, Cecia, yo quiero verificar simplemente con los participantes que les funciona la traducción, porque cuando yo cambio, a mí no me funciona.
Okay.
Are participants in English, are you able to hear the translation properly?
I'm not hearing.
Me neither.
Okay. So if you select English, it's not working.
Can you select
That's correct.
maybe, yeah, maybe select.
Just Spanish.
But you,
I tried selecting Spanish and it did not work either.
okay,
Okay, let's see.
that's weird.
Yes, because I selected English right now and it's not, I don't hear the translation.
So Yvette, if you can talk, anything, doesn't matter.
Mine says interpretation off. So I'm trying to figure out how do I turn it on.
Okay, let me see. Oh, okay. It's maybe my fault. Try now. Okay, Yvette, if you can speak just to see if the people hear you.
¿Puedo continuar? Gracias, Ana Melissa. Mencionaba que más que todo es una introducción que vamos a hacer en este momento relacionada a la mejora de la calidad, enfocado en lo que es la metodología de PDCA, que está basada en lo que es DEME y tiene ya muchísimos años, ¿verdad? Esta metodología funciona. Vamos a comenzar definiendo prácticamente lo que es calidad, ¿verdad? Una definición sencilla, práctica, que es haciendo lo correcto, en el momento correcto, de la forma correcta, para lograr los mejores resultados posibles, ¿verdad? Todo esto, el conjunto, es lo más importante para lograr tener todo este concepto de calidad, ¿verdad? Ser oportunos en lo que estamos haciendo. La mejora de la calidad es un enfoque de sistema que aplica métodos científicos, ¿verdad? Siempre está basado en datos y son metodologías que están probadas y que se han trabajado desde muchos años y que han sido mejoradas y actualizadas, ¿verdad? A fin de ir respondiendo a las necesidades. Es la ciencia de la mejora basada en ciclos de prueba y aprendizaje, programático y basado en experiencias del pasado, combina un poco la psicología con la lógica, requiere de uso de definiciones operativas, que vamos a ir viendo un poco de todo esto durante la presentación, informado por teorías de sistema y comprende la variación del proceso sobre todo. No es estático, se puede ir cambiando y mejorando según se vayan identificando la necesidad en el camino. Y cuando mencionamos lo que es PDCA, estamos hablando prácticamente de planificar, hacer, estudiar y actuar. Para responder un poco aquí, ¿verdad?, al objetivo, qué es lo que estamos tratando de lograr, cómo sabemos si un cambio es una mejora y qué debemos, ¿verdad?, en el camino, qué cambios podemos hacer para que resulten en una mejora como tal. Un poco del recorrido que tiene la metodología, que es definir el problema, ¿verdad?, que queremos luego lograr, definir medidas. El equipo de presentadoras ha hablado de lo que son los indicadores, ideas de cambio que podemos hacer, ¿verdad?, para poder dar respuesta al problema identificado, desarrollar y probar ideas de cambio a través del tiempo, medir el cambio usando ciclos interactivos y tomar acciones. Ya una vez que todo el ciclo va avanzando, ¿qué debemos hacer si lo que tenemos nos funciona, ¿verdad? Lo adoptamos o necesitamos mejorarlo, adaptarlo o definitivamente hay que abordar. Entonces, es parte un poco de la metodología. Aquí tenemos un poco de la caja de herramientas para las diferentes etapas que podemos utilizar y lo vamos a ir viendo. Por ejemplo, si queremos priorizar problemas y soluciones, pues podemos trabajar con los diagramas de Pareto de matriz de enfoque. Si vamos a medir el cambio, han hablado también aquí de los indicadores y vamos a ir viendo un poco durante la presentación cada una de estas herramientas. Empezamos un poco con lo que mencionábamos al inicio de definir el problema, ¿verdad? Siempre que estamos trabajando con los problemas, ¿verdad?, se cree o se tiene alguna como propia percepción. No, es que el problema es este. No, es que lo que está pasando es esto. Y tratamos de alguna forma de tomar como lo primero que está o lo que nos parece más obvio, pero al final estamos haciéndolo en base a percepciones. Si vemos aquí, ¿verdad? Como notas así, es muy importante la necesidad de combinar la experiencia, capacitación, ¿verdad?, de el personal de mejora de la calidad con el conocimiento de la implementación del programa y formar equipos considerando todos los actores clave. La metodología hace mucho énfasis en trabajar con todas las personas claves del proceso, ¿verdad? Si es un problema relacionado con servicios o con insumos, ¿verdad? Por ejemplo, estamos hablando que tenemos al departamento de compras, tenemos al departamento de almacén, tenemos al departamento de logística. Entonces, es integrar a todos los actores que son parte involucrada del proceso que estamos evaluando. Uno de los errores tipo 3, como se le llama, es la solución perfecta al problema identificado. Por aquí tenemos así un ejemplo rápido. tiempo de espera muy largo para realizar una denuncia en la Policía Nacional. La intervención propuesta, lo más rápido es, ok, vamos a incrementar el número de policías en el área de registro de denuncia. Estamos realizando como una suposición directa de que el problema es falta de personal, pero podría ser en este ejemplo que es que hace falta una de las computadoras, porque aunque hay 3, una no tiene instalado el sistema. Es un ejemplo rápido para tratar de ver qué otras cosas podrían influir, ¿verdad?, en la respuesta a nuestro problema. Bien. Entonces, cuando estamos definiendo un problema, es muy importante tener una declaración clara y concisa, ¿verdad?, que describa los síntomas del problema que se van a tratar, describe el alcance y el impacto del problema, generalmente una breve descripción, y aspectos como muy importantes es dónde, cuándo y el tamaño del problema, ¿verdad? Y aspectos que no debe incluir es la causa, ¿verdad? No incluye las acciones correctivas en la definición del problema porque son diferentes etapas y no busca culpabilidad. Esto también nos ayuda a que el equipo, ¿verdad?, se integre más porque muchas veces se sienten que cuando están hablando de mejoras es porque los van a despedir, porque están señalando de que no están haciendo su trabajo de manera correcta, porque los están exponiendo en toda la compañía, ¿no? Y al final es un cambio de mentalidad que se debe de hacer en la empresa. Si empezamos a hablar de problemas con completa naturalidad, miren, tenemos este problema y por lo tanto tenemos que hacer un plan. Entonces se van reduciendo un poco estos miedos y sesgos y al final, pues entre más claro podemos hablar sobre los problemas, más fácil es poder darles o pensar en soluciones. Propósitos del planteamiento, un poco esto de crear el sentido de pertenencia cuando involucramos, ¿verdad?, a todos los equipos, poder tener una herramienta de comunicación, tanto interna como externa, describir así los síntomas, muy importante el tema de que podamos medirlos dentro de lo posible, y hemos hablado un poco de esto, y impulso un poco a lo que es el análisis de causa raíz. Aquí hace un breve ejemplo, ¿verdad?, de que estamos en este problema, especificando el año, ¿verdad?, dónde es el problema, el tamaño, nos dice que ahora mismo solo el 60% de las denuncias sobre violencia basada en el género fueron atendidas, ¿verdad? Y un poco de qué es lo que está pasando al hacer este análisis. Una vez que tenemos ya identificado el problema, empezamos un poco a identificar las causas como tal del problema, ¿verdad? Que prácticamente lo que busca es entender cuál es la causa, ¿verdad?, más básica, qué es lo que realmente está ocasionando que esto pase, si igual lo pensamos en el ejemplo anterior. Si vemos, tenemos aquí diferentes causas directas, ¿verdad?, causas contribuyentes y la causa raíz. Si vemos así como este árbol en la parte de las hojas, es lo que solemos ver de manera más rápida, ¿verdad? Las causas contribuyentes y la raíz es lo que llamamos realmente el problema. En este ejemplo, siguiendo así con el mismo, ¿verdad?, que tenemos de la sala de espera, que dura 4 horas, ¿verdad?, para ser atendidos. Vemos que prácticamente es que no se podía registrar en el sistema no estaba funcionando, pero el sistema no está funcionando porque no se había pagado la cuota del sistema. Y no se había pagado porque en el presupuesto se contempló que era un sistema de que se pagaba una vez al año, ¿verdad? Entonces, se tiene que considerar que es una cuota anual. Es prácticamente ir planteando las preguntas de qué es lo que está pasando y analizar qué es lo que realmente está provocando. ¿Por qué es importante el análisis de causa raíz? Hace los asuntos pues menos ambiguos, minimiza el sesgo, incorpora la perspectiva de múltiples miembros del equipo, si se trabaja, ¿verdad?, con el equipo clave, el entendimiento completo de todos los procesos, provee datos de línea base, si tratamos, ¿verdad?, con lo que es los datos oficiales, que nos ayudan a medir el tamaño del problema. Y aquí tenemos prácticamente algunas herramientas que nos pueden ayudar a identificar lo que es el análisis de causa raíz. Si vemos los 5 por qué, podemos tomar el mismo ejemplo de la sala de espera. ¿Por qué están, verdad, durando las personas 4 horas en la sala de espera? ¿Por qué el sistema no está funcionando? Entonces, que es un poco lo que busca la metodología, realizarnos estas preguntas claves para poder dar respuesta al problema. Y otro de los que tenemos aquí es lo que es la espina de pescado, que prácticamente lo que busca es un poco organizar en cuáles son las causas principales y las subcausas de cada uno de los problemas. Y aquí pues con un mapa de... Una vez que hemos identificado lo que son ya las causas de nuestros problemas, podemos definir lo que es un objetivo como tal. Este precede, por supuesto, el problema, está siempre en positivo, claro, conciso, y nos dice más que todo qué es lo que queremos lograr, ¿verdad? Después de que trabajemos, después de que completemos el plan, qué es lo que esperamos obtener. Y tenemos aquí un ejemplo, reducir en un 20% el número de homicidios relacionados a casos de violencia basada en género en el sector de Santo Domingo en un periodo de 6 meses. Muy importante, ¿verdad?, ser claros, concisos y en qué periodo queremos lograr, tratando, ¿verdad?, de ser realistas. Este es un ejemplo parecido, ¿verdad? Por cuestiones de tiempo vamos a ir avanzando. Los diagramas de accionadores, ¿verdad?, diagramas de controladores, estos ayudan a responder la pregunta: ¿qué cambios podemos realizar que nos resulte en una mejora? Hasta ahora lo que hemos visto es la definición, ¿verdad?, del problema. Hemos intentado entender por qué ha pasado, ¿verdad?, por qué está pasando ese problema, identificando causas como tal, qué es lo que queremos lograr, ¿verdad? Y aquí un poco vamos a ver lo que son esta etapa de generar ideas de cambio. Si vemos aquí, el diagrama, ¿verdad? Estamos viendo en esta parte lo que son el objetivo como tal, que es lo que queremos lograr, los impulsadores primarios, impulsadores secundarios, y aquí ya en esta etapa lo que son las ideas de cambio. Voy a poner un ejemplo más relacionado con el área aquí de violencia, ¿verdad?, basada en género. Y podemos decir, viendo aquí uno de los indicadores primarios puede ser el tema relacionado a usuarios, ¿verdad? Usuarios con bajo conocimiento, lo que vemos ya los segundos, usuarios con bajo conocimiento sobre los sistemas de denuncias sobre violencia basada en género. Entonces aquí ya comenzamos a generar ideas y es muy importante recolectar todas las ideas que tenga el equipo, porque solemos en esta etapa decir, no, mira, para eso no tenemos dinero, no, mira, eso no se puede porque no tenemos personal que lo haga. Entonces hay otra etapa más adelante que nos va a ayudar a organizar lo que sí podemos hacer y lo que no podemos hacer, pero en esta etapa es importante que cualquier idea que pueda dar respuesta a nuestro objetivo quede plasmada, porque puede ser que en este momento, por ejemplo, no tengamos dinero para desarrollar una campaña de televisión, pero pueda que próximamente consigamos fondos y esto lo podamos realizar. Entonces siempre es bueno que quede todas las ideas que se han dejado y quizás en algún otro momento pues se puedan considerar o no. Siguiendo aquí el ejemplo, mencionando esto de los usuarios con bajo conocimiento, las dos intervenciones propuestas es desarrollar campañas, en este ejemplo, ¿no? Informativas sobre violencia basada en género y propone dos actividades, una es en televisión y otra en redes sociales. Sé que el equipo va a compartir esta presentación para que puedan ver cómo los ejemplos con más detalle. Y la siguiente etapa que les mencionaba es ya la matriz de enfoque, que es la que nos ayuda a priorizar. De todas estas ideas que el equipo ha tenido, ¿verdad? Que nos ha dicho que puede dar respuesta a nuestro problema y nos va a ayudar a alcanzar nuestro objetivo. ¿Cómo podemos priorizar? Porque a veces tenemos una lista bastante larga de ideas, muy creativas, y algunas, ¿verdad? Como que no queremos decir, mira, tu idea no sirve, pero llega una herramienta que nos facilita la vida y nos enseña un poco cómo hacer los procesos de manera más sistemática. Vamos a ver dos ejemplos específicamente, siguiendo con este mismo ejemplo del diagrama de controlador. Uno, ¿verdad? Es esta matriz que nos ayuda a organizar la información por lo que es el nivel de importancia y el nivel y de la facilidad de implementación. Entonces, siguiendo un poco este ejemplo, ¿verdad? ¿Qué tan importante sería para educar a la población sobre los conceptos relacionados con las denuncias de violencia basada en género, poder hacer una campaña de televisión? Pues bueno, el equipo considera que es muy importante, pero en la escala de dificultad, ¿verdad? O en la escala de facilidad de la implementación, ¿qué tan fácil o difícil puede ser en este momento del proyecto poder realizar la campaña de televisión? Entonces ya en esta etapa decimos, no, mira, ahora mismo es muy difícil realizar las campañas de televisión. Entonces así vamos organizando cada una de las actividades propuestas en esta etapa en este mapa. Vemos aquí desarrollar campañas informativas sobre violencia basada en género en redes sociales. Bueno, sí, también es muy importante y es menos difícil que una campaña en televisión. Entonces, al final, esta matriz lo que nos dice es que prioricemos trabajar con aquellas actividades que no son más importantes para el proyecto y a la vez más fáciles de implementar. Y luego continuemos con estas actividades priorizadas como número 2, que están aquí en color amarillo, ¿verdad? Que ya son como, están en el nivel intermedio, y las demás que podrían estar en rojo, pues a consideración del equipo, pero se recomienda empezar por esta parte. La otra herramienta es prácticamente un sistema de puntuación, es poder poner la actividad, ¿verdad? Si vemos aquí con el mismo ejemplo de televisión, qué tan importante es del 1 al 5, que se pueda realizar, el alcance realista, la probabilidad de éxito del 1 al 5, el impacto potencial, y al final lo que hace es una sumatoria de todos los puntos que se han dado a cada actividad, y por supuesto se recomienda empezar o priorizar las que tengan mayor puntos, organizarlas de mayor a menor para que se puedan trabajar en eso. Estaba un poco aquí la parte de indicadores, pero ya el equipo ha abordado este tema, así que continuamos aquí ya un poco con la visualización de gráficas como tal, cómo podemos ir viendo si lo que nosotros estamos haciendo está funcionando, ¿verdad? Tenemos unas gráficas de pastel, gráficas de barra, líneas de ejecución, mapas, ¿verdad? Cómo podemos ver la información. Estos son datos de República Dominicana. Diagramas de dispersión, entre otros. Antes de llegar a, bueno, una frase que me gusta mucho, es que no todos los cambios conducen a una mejora, pero toda mejora requiere un cambio. A veces le quitamos importancia al trabajo o a las mejoras que hacemos y o no nos damos cuenta o no somos conscientes realmente que estamos haciendo mejoras constantemente, solo que no siempre las documentamos. Y un poco de la idea de documentarlas es poder ir aprendiendo de las lecciones, estrategias y que otros equipos vean que ya se ha pensado, ya se ha hecho y que podamos tener un historial de toda la información y de todos los aspectos que hemos ido evaluando. Pero sé que cada uno, si pensamos en este momento, voy a compartir otro documento, si pensamos en este momento qué mejoras nosotros hemos logrado en nuestro trabajo, qué cosas se van realizando ahora mejor, con acciones que nosotros hemos hecho, seguro que hay más de alguna, ¿verdad? Solo que no siempre documentamos los procesos. Esta es una plantilla que el equipo, sí, ya se ve. Esta es una plantilla que el equipo va a compartir, que es un resumen de toda la presentación y nos ayuda aquí a ir siguiendo como paso a paso cómo podemos realizar un plan de mejora con algunas recomendaciones, puntualizaciones sobre la estrategia, ¿verdad? Lo que mencionábamos, la definición del problema, ¿verdad? Y las notas específicas aquí sobre qué es importante al momento de construir, la etapa de cuando definimos un problema, identificar las causas raíces, recomendaciones, qué podemos hacer, qué estrategias podemos utilizar, el diagrama de controlador que nos ayuda, ¿verdad?, a ir organizando la información que vimos. Tiene aquí la herramienta de matriz de enfoque para que ustedes puedan seleccionar con la que sea más cómoda para el equipo. Para algunos prefieren utilizar la matriz del lado izquierdo y otros prefieren la del lado derecho. Ya esto es a selección del equipo. Los indicadores, aquí tenemos algunos indicadores, ¿verdad? Y también tips claves como para poder desarrollar un indicador y por último terminar o empezar la tarea con un plan de trabajo. Realmente aquí es donde empezamos ya la etapa de poder trabajar, poder ya todas las tareas que las analizamos, ¿verdad? Que pudimos consensuar con el equipo, ya plasmarlas en un plan de trabajo con responsables, fechas de entrega, qué estatus y cualquier comentario. Así que estará a su disposición y cualquier comentario, pregunta, estoy a la orden.
Muchísimas gracias, Cecia. Si alguien tiene comentarios, preguntas, pueden volver al audio normal y yo puedo traducir las preguntas para Cecia. Pero en este momento abrimos ya you're probably back to English here. So right now we go on to the discussion phase of the roundtable. And we welcome questions for any of the panelists. If they're for Cecia, I will translate for her. Is everyone listening back in English here? Okay, I know Melissa had a question. You can start.
Yes.
I just want to say also, if there are some people that have questions in French, I can, s'il y a des questions en français, je peux parler français, moi.
Thank you.
Perfect. Thank you, Nike. And thank you, Cecia. Muchas gracias, Cecia, por tu presentación muy completa, muy clara y las herramientas excelentes. Era una de mis preguntas para ti, a ver si tenías las herramientas para compartir con nosotros. So my question, I had a question for Anastasia.
Okay.
So Anastasia, once again, thank you so much for your presentation. It was very clear. I wanted to know, in terms of evaluation design, is it possible to combine different methods to respond to one single indicator. So different tools and different strategies to respond to one single indicator to make sure that we have data at different points in time. So my question is, because we have one of our projects here at Coin, the donor actually requested pre and post tests for some of our indicators, as well as a CAP survey as a source of the data to respond to these indicators. However, the question in the CAP survey and the questions in the pre and post are different. So do you have any experience using different methods and different tools to respond to one indicator?
Yes. Usually, if you have a results framework, usually it's recommended that you have 2 indicators for each level of the results framework. And those 2 indicators can ideally be from different data sources. Now, the issue, I think, becomes if the questions are different, are you measuring the same thing? If the questions that were in survey 1 are different from the questions that were included in survey 2, are you measuring the same thing? And that is where the question formulation comes into play. We see this a lot, like in HIV work, where we ask in some surveys, they would ask, when was the last time you used a condom? And then in another survey, they asked, when was the last time you used a condom with a casual partner? Usually the casual partner condom use is higher. And so you might see a change, but the change is because of the differences in the way the questions were formulated. So I think that whenever one is using questions from different surveys, it's important to also have like an addendum or appendix where you put the exact formulation of the question. And just acknowledge that, the questions were formulated differently, so you could have some bias, in the interpretation of the change. But instrumentation effects, which is where the questionnaire is changed between the baseline and the end line, is one of the problems. Usually they call it a threat to validity for the measurement of indicators. But as long as you acknowledge that there was this change in the wording, and so that some of the change that you see in the indicator might be due to the change in the phrasing of the questions or the differences, I think that's fine. Acknowledging limitations is one of the best things we can do.
Thank you so much. It's a lot clearer to me what strategy can be implemented in that case. So to summarize, acknowledging limitations and having another indicator at a different level, right?
Yes,
right.
Having another indicator at a different, sometimes we call them proxy indicators. They might not exactly measure what you want to measure, but you can use it to represent what you're trying to show. And so if it's a proxy indicator, it's just say this is a proxy indicator. As long as you're clear and acknowledge the limitations of the indicators, I think it's okay.
All right, thank you very much.
You're welcome.
All the participants, you can write your questions on the chat or just raise your hand. You're welcome. Any questions or comments or experiences? If you want to share your experiences and your challenges, measuring the impact. I know most of the participants implement gender-based violence projects, and it's often hard to measure change. So you're welcome to share your challenges as well.
Okay, I can share a challenge. Yeah, we used a quasi-experimental design. We were looking at an integrated family planning, maternal health, gender integrated in the DLC. And we're looking at both married and unmarried first-time mothers. At the time we designed even from the protocol stage, we know that especially where people frown on unmarried mothers, we're going to have loss to follow up. So we oversampled by 25%. We inflated a sample size by 25%. So 2 years down the line, we found out that we could not locate 21% of the mothers. But because we had inflated by 25%, we were fine. So if you're following a cohort, you're following the same people over time, you're going to lose some of them. They move, especially unmarried mothers whose parents are mad at them. They might ask them to leave their homes and things like that. So they move around. And we spent a lot of money trying to figure out where they were going on a month-by-month basis. So if you do not have a way of tracking, you're going to lose people if it's the same people you're following over a period of time, especially in a major urban area. People move quite a bit. And so we had that. Now, for the male partners of these women, we also, we assumed one-on-one. And we didn't know that some of the unmarried mothers didn't want their male partners involved. And we lost like maybe 1/10 of the sample because they would not name the male partners. So we lost 1/10 of the male partners. And then male partners, relationships come and go and they broke up. And then in the end, we lost 29% of the male partners. But we'd only overestimated by 25%. That we're going to lose 25%, but we lost 29% of the male partners. So these are some of the issues. If you're following people up over time in a place where people are moving, in Kinshasa has a population of about 12 million people. People move around quite a bit, and then tracking people to where they have moved to follow them up on a monthly basis became a challenge. So it's something to think about. Attrition, dropout. How are you going to deal with that if you're following the same people and measuring the same people multiple times?
Yeah.
Hi. Good morning, everyone.
Good morning.
I'm Derek. Thank you very much, Anastasia, for sharing that, because I think that point that you made is very important. And I would particularly like to emphasize it within the context of discussions with your donors when targets are being set. I recall several years ago having engaged with a donor partner who had insisted that for the number of persons who are being trained, and that were persons who were living with HIV, being trained and were expected to be involved in the national response in various ways, that we needed to have 100% being involved at the end of the project, which was 3 years. And I was adamant that we could not go with 100% because, as you were saying earlier, we have to recognize that you will have some people who will drop out. And if you're dealing with persons living with HIV, there might be a possibility that someone could get very ill. There are persons who could die. And critically, we have to recognize too that those individuals were not being paid to be involved in the national response. And so while the donor was adamant, I asked the donor, I said, in your organization that pays extremely well, do you have control over people who leave? Can you guarantee that you will have the same number of persons in your organization at the end of 3 years? And she responded, no. I said, well, in that case, we cannot guarantee that we will have 100% of the persons who were trained at the end of the project, particularly because of the fact that we're dealing with people. And so circumstances change. And then more importantly, they were not being paid. They were trained as volunteers to be involved in the national response. I think it's really critical that we take that into consideration, particularly when we're setting our targets.
I agree. Target setting is very important. So how do you set targets? And if you have like national surveys, you can look at how change has occurred over time, how much change, and then use that or something slightly higher if you're not working at the national level, slightly higher, to set your targets. I remember I used to work in child health, and at one time, we were looking at immunization. And I'm sorry, this is not a GBV example, but it was about what percentage of children are fully immunized. In the country at the time, it was less than 30%. But the organization had negotiated a target of 80% at the national level. And I said, we have these surveys going back 10, 15 years. It shows that we are only at 30% after 10, 15 years. In 5 years, we're not going to get to 80% no matter what happens, because there are people who have myths and misconceptions. There are people who cannot get to the health facility. We're not taking the vaccines to their homes. There's so many things going on. There is no way. So target setting becomes very important. And one of the things I like about the indicator reference sheet, it has a section on where you set your targets, and you have to put a justification as to why the target is set at that level. And so it's important to set realistic targets, and there are different ways of setting targets that one could come up with.
It's interesting because when you said 80%, I was like, oh, that must be some innovative community distribution and door-to-door, very expensive, like great project.
No, it was because WHO had set up this 80% coverage, I think, in every district. And so, yes, we want to work towards that, but then we are dealing with people. My father used to say people are unreliable, but we're dealing with people, and people are what they are. They are people. They don't always follow what you want them to do. Not even your kids don't do what you want them to do. So you have to be realistic about what can be accomplished.
Yeah, and also put the price. If you want 80%, put the money out for people to do door-to-door. Everything has a price.
Right.
Yeah. Some of the standardized survey questions that I've seen on gender-based violence and that we have used are similar to would you beat your wife if she burns dinner?
The food, yes.
Yeah, something like that. So when I look at that, I'm like, do people really answer honestly those kind of questions? Because sometimes it's very easy to know the socially correct answer. So I wonder if any of you have any insights on why those questions are like that. They just seem to me like people would lie.
I think people would lie if they want to where gender norms are changing. I have worked in parts of Africa where people will not lie. They will not lie because the gender norms are so strong, especially in rural areas. I think in urban areas, especially among highly educated people, they may not lie, but their norms are changing. So sometimes it's hard to identify what's a socially desirable response and what is exactly what they believe. And sometimes, unfortunately, that's exactly what they believe. That's what they believe. And so there are other ways of measuring attitudes. And these are like scenarios that have been given. And those scenarios can change over time. Those scenarios can change over time. Yeah.
That's what I'm
And
thinking. Maybe I'm using outdated surveys in terms of developed when social norms were stronger and people didn't feel afraid of answering yes to those questions. Maybe. Derek,
Yeah.
This is something that we saw in the CAP survey that we just did. Like we had the consultants that implemented the survey separated the questions into you know the questions that would measure knowledge, the ones that would measure attitudes, and the one that would measure the practices. And we saw some discrepancies in the knowledge questions. They showed that they had high knowledge on what were the different types of gender-based violence. They were able to recognize different situations that would lead to gender-based violence. But then when it came to attitudes and practices, there was a big difference between what they knew was socially acceptable or what they thought was socially acceptable, and then how they dealt with these situations on the day-to-day basis. So I definitely think that, you know, what Anastasia was saying, you know, it makes sense in practice as well.
I just want to quickly add that, in fact, I have found that people are quite truthful in terms of responding to questions as it relates to gender-based violence. And as Anastasia said earlier, I think it has a lot to do in terms of expectations, and it has to do with the social norms, where people would share very honestly and would also try to justify the behavior, because as they become more conscious, they may recognize that I'm being honest, but at the same time, this person who is interviewing me may be judging me. So I need to provide an explanation as to why I do what I do. So I find that in general, people do. I recall years ago doing an assessment in terms of sexual abuse. And when we look at the significantly high percentage of children who were attending school who reported sexual abuse, but what we recognize that many of them did not understand it to be sexual abuse, because the question wasn't, were you sexually abused? The question had to do in terms of whether you were touched here, whether you were touched there, etc. And so they reported it because, and when one looked at the responses and also having a sense of the environment within which the study was being done, which was in the hinterland among our, in terms of indigenous population, where persons became sexually active quite early. And because for them, they did not have, in terms of their perception, that they would have a very long life expectation. And therefore it was important to become sexually active as quickly as possible, to be able to have children, so that many women were reporting seeing themselves as either dead or as grandmothers sitting in chairs taking care of their grandchildren at the tender age of 50. But that was their expectations based upon their culture and socialization.
Thank you, Derek, for sharing. Yeah. Totally agree with that. Any questions from the group? I'm wondering, Neike or anyone, if you have insights on measuring the impact of advocacy actions.
Yeah, like more recently, I've been like looking at that like more for communities and grassroots organizations and looking at like how they can measure, you know, what they do, because they do a lot. And it's really really linked to like internal reporting. So it's something that has been like, I personally have been promoting more in like a lot of the communities that I work, is giving communities these packages of very easy checklist that they need to go through every week, of like different actions that they've done, whether it is a meeting or a phone call related to the advocacy ask that is also related to the advocacy plan. But like a lot of the grassroots organization operate without advocacy plans because they lack financing and support. But that's why the advocacy plan is important, even if the advocacy goal is like unique. It's just one item, right? Or two items. But then helping helping organizations to then have like milestones, you know, on like how you reach to this advocacy goal, whether it's like a year, you know, of a timeline, or 2 years, but having like different milestones, and this milestone then giving them, it's very much almost like project management tools for advocacy, then that allows them to like, okay, this phone call was important, as small as it looks. And another way that we've been also supporting some like grassroots organizing is giving them exactly the same very simple and easy checklist. Then they can compare with each other and their different organization, how they've each contributed to the common advocacy or the common change that they're trying to implement. So I think it's since it's advocacy, then it's very related to like the soul of organizing and activism. It's a very, I think it's a slightly different approach to like M&E that like work that are looking at like, you know, more like epi and then you can you know, compare with like a cohort study and have like confounding. It's like quite different. It's very much like how we support organizations to organize what they do, and how we help them and support them in understanding that the work is professional, and it's not, advocacy is not disconnected to any other kind of like very professionalized outlook of like change making processes, and giving them like toolkits, you know, and simple toolkits like weekly checklist, who you spoke to, is it related to like this milestone, and then after a year, then you can just like go back with them, and then having them tracking and what everything they've done, and then showing them the power of their work, and so that they can themselves grow the organization and look for funding differently and show impact with the of advocacy. Yeah.
Thank you. Yes, because it's, I think for years, all the organizations we've been doing many advocacy work, but it was never like documented or made in a way that you could actually show what you were doing. That's a great idea. Any other questions? For anyone that hasn't written their name or an organization on the chat, please do so. Because we've got your names in the registration, but we don't have the organization. If you can take a moment for that. Melissa, do you have any other questions?
I did, but they've been responded to while we were discussing. So no, not at the moment, but I look forward to reading the material that will be shared with us and using it.
Yeah, we will share all the presentations and the improvement plan that Cecia developed. I need to finish translating it because I noticed that some parts were still in Spanish. We'll do that before sending it. And also we will share the recording of this session for anyone who missed any part. And I would like to thank everyone. If no one has any more questions, last chance, people. No? Okay. And thank you so much for being here with us. Hopefully you enjoyed this session as much as we did. I thank Anastasia, Nike, and Cecia for their presentations and all the information. We will give good use. We will make good use of it. And I wish everyone a wonderful afternoon. And I hope to stay in touch.
Thank you as well.
Thank you.
Bye-bye.
Thank you
Thank you
all.
very much. Have a great day.
Thank you.